Welcome to Good Works in the Heartland podcast, where we celebrate organizations and individuals who are improving the lives of others throughout Kansas, Missouri, and the Midwest. In each episode, we focus on a community group, nonprofit, or social service organization providing essential services to those in need, enriching lives, and connecting communities. On today's episode, we're talking with Kisha Steineger, a senior care consultant for Care Patrol from Northeast Kansas. Care Patrol, senior care advisors, and assisted living consultants are committed to finding the best community for your loved one. I'm delighted to have you here to talk about Care Patrol. So Kisha, thank you for being here on our show today.
Thank you so much for having me.
Why don't we get started with you introducing yourself to our listeners?
Sounds great. Hi, everyone. My name is Kisha Steineger, and I am one of the owners of Care Patrol of Northeast Kansas. And our mission is to help folks find the most affordable and best fit senior housing for you or your loved one. So that can include independent living, assisted living, and memory care. And we also help folks understand how home care can be involved and what we can do to help folks stay at home for as long as possible.
All right, great. So you serve a certain area, but Care Patrol is all over the place. So why don't you talk a little about the structure of where you're located and how your service area works?
Sure. So Care Patrol is nationwide. We are able to help people all over the country. So even if you have a loved one that's moving to or from the Lawrence, Topeka, and Johnson County area, we can meet with them here if you're moving someone, say, to California to be closer to family, and kind of get to know you here and then send that information to our counterparts in another part of the country. And same with vice versa. So I've helped some folks, move from Lawrence to Kansas here all the way to Washington State, and that's been kind of fun. But I specifically work in Douglas and Shawnee County and a little bit in Johnson County as well. And then our counterpart works in Johnson County.
All right, wonderful. That's really great. I feel like there's a lot of people who want to move closer to family as they're aging. So that's wonderful that you would be able to make those connections.
Absolutely.
Yeah. And so you've talked a little bit about your services, affordable housing, but and different. How do you choose which service they need, and talk a little bit more about the services that you offer?
Sure. So it's a little bit more complicated than some other types of industries. With seniors, a lot of times folks don't quite understand what their needs really are and what type of places can fit those needs. So we start every interaction off with kind of an interview with the family. So we will come and meet you wherever you'd like, either at your home or if you're more comfortable meeting at a coffee shop, that's perfectly fine. But we do meet with everyone in person if possible. It builds a much better relationship between the two of us, or three, however many family members you can get there. So we'll meet with you, kind of get to understand what your situation is and what your care needs really are. And then we can help you determine what level of care would be best for you. One of the other things that we'll look at, of course, is finances, because not everyone can afford the Taj Mahal. And so we keep that in mind, as well as geographic location. Trying to keep you close to your family or the services that you need, things like that. So once we kind of determined those couple of things, we have a very short list of the communities in the area that you'd like to be in that fit your criteria. So we will give you information on those communities. It's similar to the real estate sheet that you would get at an open house. So it includes photographs of the property, different amenities that the community might offer, approximate pricing, things like that. Once families have looked that information over, they'll give us a call back and let us know which communities they're interested in seeing. From that point, we will take over. So we will organize all of the tours. We will accompany our clients on the tours as often as possible, and kind of act like a gatekeeper between our clients and the sales folks, because a lot of times, larger companies really push their sales folks to be, pushy, and that can be a little overwhelming for the seniors. So we would rather them call us than, our clients or their families.
Right.
And then we handhold all the way through. So once a client has determined what community is going to be the best fit for them, if they need help downsizing, moving, applying for Medicaid, things like that, we have a short list of folks in the community that we've worked with before that we can refer and feel comfortable referring to help with those things. And then we keep up with them after they've, decided to make that move and make sure that it's, going well and things are doing, well with the community. Things don't change too often, but, every once in a while you'll get a new director. And I am the first person to hear if there is a new chef.
Oh, yeah. The menu changes are a big one, huh?
Absolutely. Menu changes and bingo.
Okay, yeah.
Don't mess with bingo.
Well, that sounds wonderful. I feel like that when you're going through a big transition like that, there's so much that you don't know. And so having someone there with you to know what questions to ask and maybe help you remember things, because you get a lot of information thrown at you, I'm sure, in these tours and just going over the website. It's a lot to take in.
It really is. And the websites never give justice to the communities. There are a lot of communities that do so much more than what their website says. And so folks will think, for example, oh, I need help with medication management and bathing. I have to move to assisted living, or I need a nursing home. And things have changed so much. A nursing home is not what it used to be, and neither is assisted living. But things like that, they're independent living communities that have services on site where you can get those, little bits of care that you need in a small increment and really make some cost savings there instead of, moving up to an assisted living level.
Oh, that's great. Yeah. A lot of people, maybe you can't age in home, but it's almost the next best thing.
Exactly.
Yeah. Okay, great. So what are some of the biggest challenges that you face for your organization or for the industry in general?
I would say the biggest one is folks waiting too long. And I completely understand everyone wants to stay in their home as long as possible, and I want that for them. But we get a lot of calls from folks that are in a crisis situation where, it was the child or the niece or the nephew saying, yeah, we thought things were going okay, and we were, starting to talk about maybe it's time to move. And then, the individual had a fall or, an illness that sent them to the hospital, and now they've declined significantly. And so you've gone from a situation where maybe someone was doing relatively all right at home and could have gone to, a very low level of care, independent living, for example, and made those good, social interactions and connections with people. And now it's too late for that. And you're talking an assisted living or, long-term care. And that's hard.
Yeah.
One of the other ones that we've seen that's a little bit more difficult is if it's a couple and a spouse passes. And if they were moved beforehand, then the remaining spouse could have made, a lot of connections in the community and friendships, and people to lean on when their spouse passed after family, isn't able to be there anymore and maybe had to go home. So situations like that are the hard ones. And then affordability. That is really tough. Just in general, what people have been able to save compared to what cost is these days. That's tough.
Yeah. And navigating the Medicare approval process, I know, is a whole other ball of wax.
Oh, yes. That's a large beast. And I definitely refer to others for that one.
Yeah. But the waiting too long, I hear that from actually in a lot of different ways, making your final will, making your DNR plans, a lot of that. It's best to do it as early as you can when you're still when you don't need it instead of when you desperately need it. Yeah,
exactly. You can take a little bit more of the emotion out of it when you do it earlier, and then it's one less thing on your plate. And I understand nobody wants to think about it. I don't want to think about it. But, it's part of life and it's inevitable. So we might as well get all of our ducks in a row there.
Yeah, for sure. So don't wait too long. Make your plan, or at least definitely talk about your plans as early as possible so people know what you want while you can still communicate that clearly.
Exactly. Because as I was saying, when people are in crisis mode, the other problem with that is a lot of times they're in a rehab facility or in the hospital. So they aren't able to, at that point, to go out and tour. Hopefully family can, and that's been great. I've also done, some FaceTime tours with folks, and that's kind of fun. But even if you're not looking, today, next year, 2 years even from now, if you can at least go out and take a couple of tours, narrow down the communities that might fit your needs, then you've got some kind of an idea to go back to when that time does come. And things will have changed, yes. But, as a general rule, if you like the community that has 125 apartments, you're probably not then going to switch to the one that has 24 apartments. So that kind of thing.
Right. Yeah. Some of the general things you like or amenities you would want. And
exactly.
Yeah. And sometimes there's waiting lists, I'm guessing, involved.
Yes.
So getting on the waiting list earlier is probably the best, especially if you do want that 24-bed option.
Yes. I just had someone that moved in this week, actually, and I met with them a year and a half ago, and they were nowhere near ready. They loved their little community, and we toured around, and they found one community that they really liked, but the option that they wanted to do was a brand new build at the community. And so it's been, an over a year-long process, and they just moved in this last week to their dream home.
Wow. And it's brand new.
Exactly. No one's moved there before. So
that's great.
All the dust is their dust.
They got what they wanted because they planned ahead. That's a great example. So what are some of the other successes that you'd like to talk about?
I think one of my favorite ones, I had my first clients that I ever had here. They were actually moving from Burlington, Kansas, so all the way over by the Colorado border, to Topeka. Their daughter lived in Southeast Missouri, so they liked to come about once a month because Jim loved to go to the casino. It was his favorite thing to do anymore. He couldn't hunt or fish anymore, all the things he loved to do, but he could go to the casino and win. So he and Jan came out once a month and would go to Prairie Band.
Yeah.
And so we toured over several weekends, and they eventually did find a place that they liked in Topeka and moved in and just loved it.
Yeah.
They had a great time. And then I heard a story that the police were called one evening because Jim was out in the community lake hunting frogs at 2 a.m. So he got a little call from me the next day going, Jim, you're 90. Why are you hunting frogs in the lake at 2 a.m.?
Well, it could be worse, right?
Exactly.
That's pretty a funny thing to get in trouble for.
Oh, that's kind of a good thing. That's not so bad.
And it's fun that there's frogs in the lake. That's fun.
Exactly.
Yeah, Prairie Band's a good time. I can see why he would want to be close to that.
Yes. Now, if he would have just given me a few of the tips as to how you win,
Right.
that would have been even better.
I know. My dad's a good card counter. I can't do it.
I would never know how, and I have no poker face whatsoever. Yeah. So.
All right. So let's see. Okay, we talked about that. Do you have any events or outreach or fundraising idea? Do you fundraise at all or?
We don't fundraise for ourselves. We operate similar to a real estate agent, so we are completely free to families, and then we're reimbursed by the communities that we work with. Okay. But that being said, we do work with a lot of organizations. The Alzheimer's Association, for example, we do a lot of fundraising and things with them. Other senior organizations. There's a local one here in Lawrence called the Lawrence Area Partners in Aging. So I'm on the board there, and so we work closely with them. A similar one in Topeka. And do, senior resource fairs. We'll do talks, kind of anything that we can do to, help folks and educate.
Okay. Well, you'll definitely be at the April 17th Senior Resource Fair here in Lawrence.
Definitely.
At Rock Chalk Park. So that is the Lawrence Area Partnership in Aging, LAPA Senior Fair. So mark your calendars for that.
Yes, that will be exciting. One of the other good events that's coming up is the second annual Lawrence Caregivers Conference. And this year it is Self-Care, Learning to Reclaim You. And that's presented by the Jayhawk Area Agency on Aging. It will be April 25th from 9 a.m. to 3 p.m. at the First Southern Baptist Church here in Lawrence. And we have a couple of good speakers. So the ones that are kind of mentioned here, Dr. Herder from the Lawrence Internal Medicine. He'll be speaking on advocating for the best medical care. We also have the benefits of home health. Sam Brummel, who is a licensed social worker, will be talking about say no to get yes. We have Megan Mooney talking about anticipatory grief, and I'll be talking about tackling caregiver burnout. So that's going to be a nice free event for caregivers and lots of good information there.
All right, wonderful. And on the 17th at Rock Chalk Park, that goes from 10 to 3?
10 to 1.
10 to 1. 10 to 1. Okay.
And that's also free for seniors to attend. So please come out. There will be about 50 different vendors in the area, and you'll have information on everything from home care, home health, hospice, all of the communities. We've got rideshare programs that'll be out there and lots of free goodies and fun people to talk to.
Yes, you'll fill a bag full of fun things, and audio reader will be there too. So
Yes, and get your steps in.
yes. Oh, we haven't talked about where people can learn more. So the website is carepatrol.com.
Yes. My direct cell phone number is 785-766-9005. And I am also very open to texting, so feel free to text me on that number if you like as well.
So let's go back to, I saw on the website there's 4 sort of main categories of locations that you're sending people to. Could we talk about what those levels are and what someone could look forward to when they're...
Sure. So some of the most interesting places I like to take people, we have independent living, which is going to be your lowest level of care for folks. Typically what that means is a community that will provide things like meals, transportation, activities, weekly or biweekly housekeeping. Sometimes they have laundry. So it is the lowest level of care, but you're still getting some amenities. So it's not completely living on your own or in a 55 plus environment. So those are the lowest levels that we work with. And sometimes some of those communities will have additional care services on site that's performed by a third party. And that really can help bridge the gap between an independent living and an assisted living. So it allows you to get a little extra care, but brings the cost down to something right in between.
So is that like almost like a private urgent care or something like that?
It's what's called home care. So a home care person is an unlicensed individual that can come in to support someone similar to what we would call a surrogate daughter back when I was doing home care. So they can help with bathing, help someone get dressed, go run errands for them, make meals, do light housekeeping, anything that's not direct medical care or would require a license.
Okay.
And those services are provided from 1 hour up to 24 hours, and that's typically private pay. There are some Medicaid services that will cover little bits of that and grants as well, but it's primarily private pay.
Okay.
Once you're no longer able to do independent living, then you would move up to assisted living. So that has all the amenities of independent living, but then they have care staff on site 24 hours a day. So you'll have a certified nurse's assistant and certified med aides that are able to provide medical care and medications to folks. So if you need help with bathing, dressing, getting in and out of a chair or in and out of bed, maybe you need help in the morning, but not necessarily in the evening, some memory issues, things like that, then you would move to an assisted living. And then there are other 2 options we have are what's called Home Plus.
Okay.
Home Plus is a home that was either constructed or renovated to house no more than 12 seniors. Some are individual rooms, some are private, and it looks like a home and feels like one because essentially it is. So the great thing about these communities is they really have a lot of care staff for the residents. So your staff to resident ratio is excellent. And these places are great for folks with memory issues or very high physical needs. So they are typically a higher level than just a traditional assisted living, and they can almost meet what would have been called a nursing home. Now we call them long-term care communities formerly, but in a much more home-like environment. So those places are great. And then we've got memory care. So the primary difference, and this is what I get asked a lot, is when do I know if my loved one is memory care appropriate versus assisted living? And the answer is that in today's world, most assisted livings can tackle some cognitive decline, provided that the individual doesn't have, a lot of behavior issues or if they are an elopement risk. So the biggest difference is if someone is an elopement risk and they might wander out of the community, then you definitely need memory care in that secured environment. Or if they have, certain types of dementia, Lewy body, for example, would be one that only a memory care would be able to really handle once you get into the more latter stages of that disease.
Okay. Yeah. Okay. Great. So it's really, there's a lot of different variety depending on what your needs and what your wants are. If you want that big community with a big bingo game, then maybe more independent living or assisted living. But then there's the small community option, which I feel like would appeal to a lot of people who like that home environment. So.
Exactly. And that's where, the initial meeting or 2 meetings is so important to get to know folks and just what they like. The first folks I had told you all about, Jim and Jan, that moved into the community in Topeka. Unfortunately, because they lived in Burlington, I was only able to talk to them over the phone initially rather than meet with them in person. And so we pulled up to the first community, and I thought, Jan would just love this place. And as we're walking in, she said, my favorite thing to do every morning is to sit at my kitchen table and look out my window. And my heart just dropped because there is not one single apartment in this community we're about to walk into that has a kitchen by a window.
Oh, no.
All of the kitchens are in the middle of the apartment. And I just thought, wow, well, if I would have known that, I never would have brought her here. And ultimately, they didn't choose that community. And that wasn't the only reason. But it's little things like that. Yeah. And that's one of the tips of advice that I give folks is, think about your day and what's the most important part of that day to you. And if it's sitting on a porch drinking your coffee, then tell us that so that we can make sure that wherever I take you, you have that, option and that thing to look forward to every day.
Yeah. Yeah. A lot, those little details, those little routines that you really want to enjoy and keep. It's great if you can keep those if you transition to someplace that isn't your house. So
yes, very much so. Because that's really what we take with us, our memories, our habits, those things. The rest of it is a wall at the end of the day. Yeah. One we're attached to. Or 4 that we're attached to, but.
Yeah. All right. Well, I think we're running out of time. Is there anything else that we haven't covered then?
The only other care, and we don't really work too closely with long-term care, and that would be what you're kind of thinking as the traditional nursing home for folks. So just so folks are aware of what that consists of, those places are the ones where if you have someone who has diabetes that requires an injection and they cannot self-manage their diabetes, then you're definitely looking at a long-term care. Same thing with folks who might need a ventilator or an actual LPN or RN that's on staff 24 hours a day. Okay. You can find an occasional assisted living that's able to do that, but for the most part, that is at the point where you would end up being a long-term care appropriate client.
So much more medical intervention needed or constant medical intervention. Okay. And what are some of the other questions that you feel like you get a lot that people are curious when they're starting this process?
Sure. The biggest one is the payer source. Who's going to pay for this? And then folks get confused as to the difference between Medicare and Medicaid. So the easiest way to remember it is Medicare pays for your actual care. So that includes your doctors, a hospital, rehab facility, things like that. But it does not include room and board at a community. So when you then go to apply for Medicaid, you need to be aware that independent living communities are not able to accept it. Okay. Assisted livings, there are a few that do, but not very many. And then long-term care does accept Medicaid as a payer source. So basically, in order to qualify for Medicaid, you need to get down to less than $2,000 in assets. Okay. And the best resource for that would also be the Jayhawk Area Agency on Aging. They are able to help folks to understand that process, fill out the paperwork, and then kind of go through all of that. And then when it's time to find a place, you can call me.
Yeah. And if you're not in the Topeka or Lawrence area, a lot of the local senior centers have resources on how to help with Medicaid, and also the Whole Person in Kansas City. They have a location that will help you with that paperwork too, if you're on the Missouri side. So,
good to know. I didn't know that one.
Oh yeah. That paperwork, I can only imagine, and it changes all the time. And so it really is a full-time job for many people out there to just keep track of all the different changes in the policies and from year to year and all that medical. So and this is in October, of course, but Medicare re-enrollment, that's going to be an important time to make changes if you're planning ahead for long-term care.
Yes, very much so.
Yeah, all right. So that's it for this edition of Good Works in the Heartland podcast. If you'd like to learn more about Care Patrol, make sure to visit their website, carepatrol.com, or you can call Kisha directly at 785-766-9005. And we'll also post this information on our social media, so be sure to follow Good Works in the Heartland podcast on our Facebook page or find us on Instagram. So thank you again, Kisha, for being here.
Thank you so much for having me, and I hope everyone has a wonderful day.
Yeah. So join us again. We'll be talking to, in 2 weeks, we'll be talking to another organization doing good works in the Heartland. Again, my name is Martha. This episode was produced by Nick Carswell. Thank you for listening.
This has been a production of the Audio Reader Network.